one of the concerns that a lot of people say is, well, I don't want to take the vaccine because there's a potential for some side effect that may happen. So, the two things I tell people is show me a hospital that's overran by vaccine injuries. I mean, I've yet to admit one person or take care of one person with an injury from the vaccine. Now, when you get the vaccine, there's a difference between an adverse reaction and side effect. So if you get the vaccine and you have aches and chills and soreness in your arm, that's letting you know the vaccine worked. In fact, I would almost be a little more concerned if I had no reaction at all to the vaccine. But what the governor and I was talking about is in the office, in the outpatient setting, people say, well, I'll just get COVID. Every single day in the outpatient office, we're seeing patients with complications from COVID infection. In fact, the literature clearly states up to 5 months, many people are still having symptoms and not fully back to normal after COVID infection. We're treating every day blood clots in the lungs, blood clots in the legs, problems with the heart, hypertension, people that's had strokes, people that's still having chronic shortness of breath from COVID infection. So who knows what COVID infection is going to do long term? We know that there's people all over the internet that's concerned about possible long-term effects from a vaccine, but again, look at what's going on in your local hospitals. The people that are primarily dying, the people that are primarily in the ICUs on a ventilator, 95 to 99% are unvaccinated individuals. So even though you may survive COVID, it's just worrisome to me to see, 2, 5, 10 years, what's going to be the long-term effect from that COVID infection? Yeah, you may get some antibody protection, and you survive the initial illness, but what's going to be the long-term effect? And I think that's something that a lot of people don't pay attention to.
Well, Doc, thank you. And can I just go over this one more time, just exactly what Doc just said? He said, first of all, he has not treated a single patient, not one patient has he treated with a significant adverse reaction to taking the vaccine. Am I correct in that, sir? Okay. And the other thing he said is this, that 50% of the people that have COVID 5 months later are still having some kind of side effect from that. Is that correct also?
Case report shows that a significant proportion of people that have COVID still have effects 5 months.
Yeah. Well, and then the argument behind, well, I'll just get COVID and then I'll get over it and then I'll be fine. Versus take the vaccine. Here's a doctor that has not treated one person yet, and he surely said that we're not getting overrun at a hospital because we have people that are having adverse reactions to the vaccine. Anything but that. Really and truly what we've really got is almost no one has had a significant adverse reaction to the vaccine. So that's your choice. Your choice is almost no one has had a bad reaction to the vaccine. And your choice also is if you get COVID and you think that's a way out of this thing, people are having long-term, very significant long-term negative effects from having COVID. If you survive. I mean, you got to listen. You got to listen to these people. These people are really good people, and they're really smart, and they're trying to save your life every day.